As you all know, life has drastically changed over the past weeks here in our state, across our country, and certainly across the world. Our Georgia children are now at home. Many Georgians are working remotely. Our public gatherings are few and far between, and that's for a very good reason. Some healthcare facilities, including Georgia hospitals, are ramping up their capacity as they see more and more patients and are providing critical treatment to those that are in need. Leaders at the federal, state, and local level are working hard to make the right calls at the right time to keep our citizens safe. I will tell you there are no easy answers, and the guidance continues to change as we fight to stop the spread of COVID-19. Moving forward, we must remain dynamic and responsive. To weather this storm, we have to stay united in the fight, and Georgians deserve to have the facts to make the right decisions for their families. They need as much information as possible to keep their loved ones safe. Yesterday, there were 197 cases of COVID-19 in Georgia, spanning 29 counties with 3 confirmed deaths. Today, there are 287 cases of COVID-19 spanning 36 counties. That now includes Bibb, Early, Glenn, Lawrence, Muskogee, and Peach that previously had no cases. We are actively investigating confirmed cases in certain long-term care facilities, which, as you all realize, presents a unique and time-sensitive challenge. So far, the Department of Health State Lab has conducted 508 tests for COVID-19 with 113 positive results. State officials have deployed mobile testing sites in certain regions of Georgia, and there's more that are on the way. The commercial labs have conducted over 1,300 tests for COVID-19 with 174 positive results. Due to the volume, some of the commercial tests are taking longer than the standard 48 hours to get the results back, and I'm certainly urging those labs to continue in a timely fashion as we go forward. This morning, I was encouraged by the news from the White House that vaccine development and antiviral therapies are moving along quicker than originally expected. Certainly applaud the Trump administration's leadership in removing unnecessary red tape and outdated rules to deliver real solutions for American families in this crisis. Even with these developments, we must start to prioritize COVID-19 tests for our most vulnerable populations, as well as people responsible for care and safety. This action will conserve precious medical supplies like masks, shoes, covers, and gowns, which are becoming increasingly difficult to find due to overuse, export banning, and hoarding. Health officials on the state and national level urge the public's immediate cooperation with this. Georgia's elderly, those with chronic underlying health conditions, those who live in long-term care facilities like assisted living facilities, nursing home facilities, and those serving on the front lines as healthcare worker, first responder, long-term care facility staffer, or law enforcement need those tests. The best way to serve the public is protect those who are protecting us. As many of you know, I recently declared a public health state of emergency in our state and authorized GEMA to work with the Georgia National Guard to activate up to 2,000 troops to assist in the emergency preparedness and response efforts as needed. On Monday, the Georgia General Assembly convened for a special session to ratify the public health state of emergency. I'm very grateful to the House and Senate for taking swift action so we can deploy all necessary resources to help our fellow Georgians in this time of need. We also continue to update the appropriation chairman in both houses on how we plan to use the emergency spending in the amended budget. Unlike other states of emergency, this declaration allows the Department of Public Health to direct specific health care action in these extraordinary circumstances. We are moving forward using the advice of health officials and emergency management officials at all levels of government. Already, we have learned of looming supply shortages at specific hospitals in Georgia. I want you to know that we have taken immediate action, working with federal officials to secure more tests, as well as critically needed materials from the national stockpile. We are coordinating supply delivery to healthcare facilities that are in need, and we are certainly grateful for all of those who have offered up their inventory to help others. Your sacrifice is literally saving lives. Earlier today, the Centers for Medicare and Medicaid Services issued new guidance to the American healthcare workforce, asking for a delay in the elective procedure to conserve medical supplies and to free up medical staff. The Georgia Department of Public Health, the Georgia Emergency Management Agency, and I urge all health facilities to follow this guidance as well. There is no doubt that without a question, we are going to need these resources in the days and weeks ahead. As the number of Georgia cases continues to rise in communities across Georgia, hospital bed space continues to remain a serious issue for us all. State agencies are working in tandem to determine the existing capacity and run the numbers on potential needs. This work is ongoing, and we will continue to provide updates as this situation changes. Fortunately, we continue to receive offers from the private sector, including great companies like Walmart, the Atlanta Motor Speedway, UPS, and others, to name a few, to utilize private real estate and other resources should the need arise. We are grateful for that offer. At the Georgia Public Safety and Training Center in Forsyth, Georgia, GEMA has almost completed installation of a new patient isolation zone that will be ready for emergency housing units. Hard labor at Creek State Park is still an asset to our disposal, with 7 trailers on site if patients with COVID-19 have no alternative housing during the recovery. We have 1 person there today. In accordance with public health state of emergency that I declared, all elementary, secondary, and post-secondary public schools closed yesterday on March 18th. That will go through March 31st. In many circumstances, online learning will continue, and both the university system of Georgia and the technical college system of Georgia have moved to online learning for students through the end of the semester. On a case-by-case basis, school officials are working to accommodate students who require in-person clinical experience to complete their coursework. As you can imagine, many of these individuals are needed on the front line of this healthcare fight. I wanted to also address something that sadly is true. Misinformation is certainly rampant in times of crisis. I want to thank all of the Georgians out who have alerted my office to potential scams. We are working very hard to keep people apprised of what we discover, and I encourage people to continue to rely only on official sources for information. If you see something suspicious or hear about it, please let us know. Part of our response includes a new COVID-19 hotline for all Georgians. On average, our team has been receiving 700 to 800 calls each day to share public health information and to connect people with the resources that we have available for assistance. I'd like to give you that number now. 1-800-442-2681. Again, that's 1-844-442-2681. Right now, we have 209 passengers from the Grand Princess cruise ship meaning at Dobbins Air Force Base Reserve. Officials are making plans to get people home to their states when they can be safely returned. As you know, we had 487 people there at one time. As you can imagine, as a husband and father of 3 girls, I understand the concerns and fears by people across our great state. Despite all the unknowns, know that we're working to prepare for and respond to any scenario. Our top priority is the safety of our citizens in every corner of this state. We work to flatten the curve and keep communities safe. We are certainly mindful of all of our small businesses that are affected by this crisis. They are the lifeblood of local communities and employ millions of hard-working Georgians. As a small business person for over 3 decades, I know firsthand the stress and strain this pandemic has caused on Georgia entrepreneurs and job creators. I'm proud to report that yesterday the U.S. Small Business Administration processed Georgia paperwork to allow small business owners to apply directly to economic injury loans. This application is now available online directly through the SBA. To stop the spread of coronavirus, we must follow the guidance that we have been receiving from federal and state health organizations as well as the leaders. Regularly wash your hands. Practice social distancing. Go at all costs and protect the elderly and chronically ill and get them to stay at home, especially if you are sick. If you're experiencing symptoms consistent with COVID-19, I want to urge you to call your doctor or urgent care clinic. Go up at an emergency room or your doctor's office unannounced. Fellow Georgia to follow the medical recommendations that we are giving. Right now, I'm mandating business closures, shutting down public events, or forcing people into quarantine. I am, however, leaning on the advice of medical professionals and scientists, as well as urging local officials to do what is in their best interest and the best interest of their communities, keep their communities safe, stop the spread of coronavirus. We are all in this fight together, and together we will emerge stronger than ever. I would like you to all continue to pray for our men and women in law enforcement, our first responders, and healthcare providers across the state who are doing everything in their power to keep us out of harm's way and literally save lives around our state. To all of the business owners who stepped up to offer assistance, who had to make decisions for the greater good, the future may seem uncertain, but know that we stand with you. With that, I'm going to run through some questions that we've received from the media, and at the conclusion of that, I'll see if we have more that have come to us during my remarks. The first question is thoughts about a statewide mandatory quarantine. At this time, I do not plan to issue a statewide mandatory quarantine. I continue to call on locals to take the appropriate action for the communities. I can tell you that I'm in touch with the community leaders in many of the hot spots that we have seen around the state, asking them what they need, if they needed me to act, and at this time, they're telling me that their communities are stepping up, they're following the guidelines and the advice that we're giving them, and that is making a real difference. And they are saying, do not do this at this time. The second question is, would there be a no payment policy for government-run utilities to help the population pay or discount on utilities? I will tell you that some companies have enacted these policies to temporarily halt disruption in service due to non-pay, but it depends on that company. The third question is, when are you going to mandate the shutdown of bars, restaurants, and citywide shutdowns like San Francisco and New York to prevent the spread, and why the delay? At this time, I do not plan on forcing businesses to close. If the circumstances change, I will take the appropriate action. For now, I believe most Georgians are heeding the advice of health officials and medical providers. Our decision will continue to be based on the facts and the expert advice we're getting from healthcare providers and folks like Dr. Toomey in the Georgia Department of Public Health. Next question is, how can we help healthcare workers who have children? Parents can search for child care on the Department of Early Care and Learning website, www.qualityrated.org. That's www.qualityrated.org. I want to commend Amy Jacobs and her team at DCAL for this great work that they have been doing. Parents can 1877. All GA7. All GA. That's 1877. All GA kids, and speak to a child care expert. As of this morning, 916 child care programs are open, and over 1,100 are now closed in Georgia. Yesterday, we put out a press release applauding the YMCA of Metro Atlanta for all child care for health care workers. This is quite an amazing thing that's been put together. I will let you know the Y is already at capacity, so we are directing parents to the Department of Early Care and Learning for more direct assistance. The state, as I mentioned earlier, is now reporting 10 deaths. Which counties are they from? This is another question. The counties are as follows: Early County 1, Fayette County 1, Darke County 4, Floyd, Fulton have each, and Cobb County 1. The next question: many people are upset that a state senator went to the Capitol earlier this week when he's showing symptoms consistent with COVID-19. Can the governor speak to the senator's decision and precautions he might be taking? I would just say that this is a good example of why we need people to follow us our advice, follow the advice of their medical provider. Stay home if you're sick. If there's any doubt, stay home. We've had this happen in many places around the state. Sick individuals attending funerals, which has created one of the hot spots that we have around the state. And I think this is a good example that we can all learn from. The next question is the governor spending the state's certificate of law and to give nurse practitioners freer rein to respond to the crisis. I will tell you that at the time that we are reviewing both of the proposals with our legal team, and we will continue to keep the public updated if we decide to move forward with that. The next question is: how many doctors and nurses have tested positive for the virus so far? We do not track positive cases by profession. The next question: how can private labs apply to the state for reimbursement? At this time, a state lab is conducting its own test, and private companies are acting independently. I will people, as we mentioned earlier, we're asking to set tests for the frontline health workers, the elderly, the medically fragile, other folks that are priority, and this is coming directly from the CDC's advice so that we can test the people that are on front lines of keeping us safe in our hospitals and medical facilities. I would caution Georgians that we get tested if they're trying to do that through a private site. To assure you are vetting that site. If you have any questions, please call the 1-800 number for advice on whether you should be tested, and if you're going to do that, that would be available to the private sector. The next question: will the state place orders such as curfew or a shelter-in-place order? As I've mentioned before, that is not under consideration at this time. I want to continue to urge Georgians to follow the directives that we've given. Avoid large gatherings, practice social distancing, and make sure that you home if you are sick. You need to wash your hands and down surfaces others may be exposed to. The next question is: how will the new drugs approved by FDA be distributed to Georgians? As you can imagine, we are working very closely with our federal counterparts on this and many other things, and we'll keep updated on plans for distribution when this becomes a reality. This question is: a number of businesses in my area are asking if the governor can do something about tomorrow's sales tax deadline, March 20th. March 20th, the deadline for businesses to pay their February sales taxes. I'll tell you that our Economic Impact Committee of the Coronavirus Task Force is actively researching this option and others, but at this time there are no plans to delay the payments for tomorrow. The next question: restaurants in my area want to know if the governor has the power to waive on alcohol sales coming out of the door. They have a large amount of alcohol that they cannot sell with the closure of dine-in sales and they also need the cash flow. I will tell you that we are continuing to work with the hospitality industry to look into this possibility, other things that they are trying to work with us on to help them in this great need. As you can imagine, that is an industry in our state with many others that have been severely affected very quickly by these happenings. The next question is, does the governor have a message to houses of worship for this week's service? While many in Atlanta are not meeting, we are seeing a significant number of churches and other religious organizations holding services in rural Georgia. I would urge people to please consider moving the services online. We've seen several instances around the state where members of congregations have been affected, and before they know it, they are spreading out in their local community. I know firsthand what a tough call that is. My church has experienced the same, moved from not electing to do that last Sunday, moving to a completely online this Sunday. I know many people have differing opinions on that, very sympathetic to it, but I'll tell you that there are real-world solutions that are real-world problems that have happened. Infected people going to services and helping spread and create hot spots around our state. So I would ask religious leaders to pray deep and to consider holding services online or deleting those services. The next question, I'm interested in hearing the latest regional test sites that the state is working with FEMA to set up. Are those close to being ready? Yes, they are. Those lists are underway. We'll be announcing that as soon as we can, but I can tell you that those facilities are being stood up right now. There was some soft testing that began yesterday to make sure we have the process and the procedures down, and we'll continue to share information with the public as soon as it becomes available. The next question is, what a message to Georgians who are worried about making ends meet because they've been laid off or lost hours because of the crisis. I can tell you that here in Georgia, we continue to work with the Labor Commissioner Mark Butler and his department to issue guidance and help people in this difficult time. I know from my call today with the President, the Vice President, and the nation's governors that they are continuing to follow this issue very closely, especially industries that have been adversely affected when you think about the state of Georgia. The airline industry, hospitality industry, the convention center businesses, and certainly small businesses that have a tough choice to shut down or been forced to do so. The next question is, how concerned is the governor about the situation in Albany? I can tell you that I'm very concerned. There were 2 funerals in Albany that led to multiple cases and possibly 4 deaths in Dougherty County. This situation could not be more serious. I want to urge the community leaders, the business people, the faith leaders to all have a conversation to educate the public of why it's important for people to do the right thing and to do it immediately. Social distancing, stay at home if you potentially could have been attended one of those funeral services, and many, many other things. I will tell you, late last night I was on the phone with the chairman of the commission down there who is doing great work to work with the local community to raise awareness. I asked him specifically if there's anything he needed to do, action he needed to take. He mentioned a few things to me which we have already deployed the Department of Public Health resources there. We are working on the additional quarantine site that they feel like they'll need to be made available. GEMA's working on that. So we have the F team, I believe, as well. Dr. Toomey may want to speak to that, but I believe they're already on the ground there, and we are on top of that situation. But we need the community's help to stop that. The next question is, do you expect the number of cases to go way up over the next couple of weeks? Absolutely, I do. I believe, as we've said early on, when we didn't have many tests back and we didn't have many results in, that the more we test, the more we'll find. We certainly saw that today. I think that will continue, and I will tell you that our whole team that is literally working 24/7 on this continues to analyze the data, not only here in the state, but comparing that to other states and cities around the country so that we can gauge how that situation continues to move. We will continue to do so, continue to base decisions on that data and the advice of our medical community. The community, especially the hospitals around the state, and we have folks looking at procurement and other things to help us solve that problem. For those of you that followed the call with the president and the vice president today, I've asked them to consider keeping the federal medical facility that was stood up to support the cruise ship passengers that we have been housing at Dobbins. I've asked them to consider leaving that facility stood up after they leave to help us with the surge that we are starting to see and that I believe that we will see in our metro Atlanta hospitals. But Georgians should know that we are going down every nook and cranny to find resources that will make bed space available to the hospital. And I will tell you, our hospitals continue to do some incredibly creative things, and there's a lot of people working on this issue. The last question I got, and then we'll turn over and see if we had anything else come in, is could Governor Kemp talk about the state revenue picture and what he thinks this means for the end of the current year budget and the upcoming budget in 2021. I will tell you that we continue to monitor that. That is something that our state economist, Jeff Dorfman, the OPB, our budget director, Kelly Farr, the two chairmen, Chairman England, Chairman Jack Hill from the House and Senate Appropriations Committee, and many, many other people are continuing to work on. We realize that this is going to be a very tough environment. We don't know exactly what the federal government's going to do from a disaster funding. I threw out an issue today to the president and the vice president. I know there were other governors on that call that weighed in after I did that supported that idea. I know they have many things being thrown at them right now. We have made and are in the process of making our congressional delegation aware of that issue. But I know that is something that the president and the vice president are taking very seriously. And there's been great conversations. We've had conference calls with them weekly or bi-weekly that are, have lasted, some of them as long as an hour and a half, hour and 45 minutes. Today, I know it was at least an hour and 15 minutes. They answered every single question from whatever governor that wanted to ask it. And they got a lot of ideas on their plate. But the thing is they're considering those, and they're hearing from the governors who, like the local communities, are on the front lines of this battle, and I certainly, for one, appreciate that. But we'll continue to monitor that very carefully. With that, I'm going to see if we have any other questions that have come in. Okay, at this time, we don't have any other questions. I'm going to turn it over to Dr. Kathleen Toomey, who is the director of the Georgia Public Health Department in our state. They like our team and local communities and folks on the front lines of the health care with our emergency responders, EMTs, and law enforcement, people at GEMA, people at the National Guard that have been delivering supplies, literally working 24/7 on this issue. I want to thank Dr. Toomey and her team, all those hard-working Georgians that are literally deployed all across our state, supporting the local communities. I want to thank her for what she's doing, and I'll turn it over to Dr. Toomey. Thank you.
Thank you, Governor. I received many questions, some of them duplicates, so I won't repeat the questions, but I'll augment some of the answers where appropriate. We had a lot of questions about testing. I think this is a continual question about our testing, how we're doing it, why is it limited. We have right now newly purchased 500 test specimen collection kits. So this is to be distinguished from the test that's done in the lab. You need a specimen collection kit in order to secure the specimen to send to the lab. Our public health laboratory, by the end of next week, has over 200, the capacity to test over 200 of these specimens. But you need to have these swab kits to secure the specimen. So we have 200 now. 500 now. We will distribute them across the state. And in addition to these 500, we'll be getting additional large number of test kits, as well as testing to be done by a private laboratory, to be done at the newly stood up kind of I'd call them SWAT sites across the state. I wanted to talk a little bit about that because there's some confusion about who can be tested and also how that process works. The high-capacity sites were actually selected precisely because there are some areas of the state disproportionately affected. Metro area and Bartow and Rome area have many, many cases. And as the governor noted, some of these cases actually emerged out of church services, so we're particularly sensitive to this issue because of the way we've seen spread in these areas. So we have selected Cherokee County as the site, as a testing site, not because of the actual central location to serve both Rome, Bartow, as well as the greater metro area. And we are hoping we'll be able to do over 100 specimen collections a day, if not more, once these are ramped up. And we're hoping that will be done, will be set up as early as tomorrow, and certainly working in progress by next week. The second site where we have one of these high capacity sites will be Albany. And as the governor noted, Albany is one of our areas, hotspots around the state. We recognize we have to work very diligently with the hospital there, as well as the broader medical community, to ensure we have the capacity to follow up individuals at high risk. We have limited testing statewide, even at these high capacity test sites, to the individuals who are most at risk for infection, that is the elderly, that's over 60 years old, those with chronic health conditions, and those are symptomatic individuals, not just people who have these conditions, but who actually have symptoms already, but also healthcare workers. Healthcare workers are the first responders for us. They are on the front line. We have to ensure that they are healthy and safe and able to provide the care that we need. Also EMS and other first responders, police, fire. These will be our prioritized people to be seen at all of our test sites statewide, not just at these high capacity test sites. We have worked with the private sector, both hospitals as well as private sector physicians, community health centers, others, to get these guidelines out and to arrange a mechanism to actually have referrals into these sites. And so it's a simple process to make this referral. We should be able to have the capacity statewide to take these referrals from providers. And part of this is because we have been asked by providers to do this. Many primary care providers and pediatricians, family practitioners, others across the state don't have the capacity within their offices. They don't have the equipment, don't have these specimen collection kits to do this testing. We want to be able to allow them to do this testing, and we will be working in partnership with them. So this response is literally a public-private partnership, the healthcare system partnership with providers at the local level, hospitals across the state, and public health across the state. So we have all hands on deck, all of us, whether you're in the private sector, a hospital sector, or public health. There's a lot of questions too about why have our numbers gone up so dramatically? Part of that is, as Governor noted, is we're doing more testing, but also it's not unexpected. We are seeing community transmission, particularly in some of these hotspot areas. And so in some ways, the message we're trying to get out to everyone is that testing is important, but the most important thing that Georgia Public can do right now is follow these guidelines to stay home. Don't go out if you're sick. Honor the social distancing requests. Help your elderly, that they don't have to go out and secure groceries or get themselves exposed. Make sure that you protect your neighbors as well as yourself. And as I've said so many times, our response to this epidemic is going to require all of us working together, not just to protect ourselves and our family, but also the whole community. So it's going to take this collective effort of working together to ensure that we can combat this virus. And I believe that's most of the other questions I had. I also received a question about the quarantine in the Georgia House and Senate. And I just wanted to say that decision was made certainly in consultation with me, but also that recommendation was not any different than we would make to a church, to a school, to any other situation where there was the potential for widespread transmission, widespread exposure to this virus. And it's the right thing to do. We're so concerned that we want to stop transmission wherever possible. And so this was not done just because they were legislators. This was done because this is what we need to do in every situation where this kind of exposure may occur. And I think that answers most of the other questions that I had. Thank you very much.
I want to again thank everyone for joining us. I want you to know that we're going to continue to keep fighting every day. We need your help, as Dr. Toomey said. We'll continue to keep you updated as we have new developments. And please just continue to practice the things that we're asking. Have a great evening.
.300. The spread of COVID-19 in Georgia is easy to see when you look back only 1 week. 287 confirmed cases now versus 31 on March 12th. And as of today, cases have been confirmed in 35 out of 159 Georgia counties. A week ago, it was just 12. Fulton County leads the way with the most cases at 66, but an odd fit amongst the top 4 counties is Bartow. Its population much smaller than the other top 4 counties, with 26 confirmed cases there, and it is only home to 106,000 people.
My breathing is pretty good. The past day or so, it's been very good.
Jason Hasty lives outside Augusta and says he received a presumed positive test result on Monday for COVID-19 following ongoing flu-like symptoms. He's still waiting an official confirmation by the CDC. He believes he may have been exposed to the virus at the church at Liberty Square in Cartersville, where several members of the church have now also tested positive. It is the church Hasty's father attended before his recent death from cancer. He attended services on March 1st and 8th to remember his father.
I feel sad that Bartow County in particular has had so many cases and quite a, it seems like a fairly large percentage. Now, I don't know if they've had more testing.
Hasty says in between his trips to church at Liberty Square, he also headed to the state capitol where he qualified to run for district attorney for the Augusta Judicial Circuit. He says he did not feel symptoms of COVID-19 at the time other than some aches.
I felt great. I was able to stand on my feet stood in line for an hour and 45 minutes. Didn't feel really any problems.
But now Hasty is quarantined at home until he hears more instructions from health officials and his doctor. And those cases statewide, they continue to increase for COVID-19. At the same time, the virus is being found in more and more counties. Peach, Bibb, Muskogee, those are just some of the counties being added to the state's list today where there are confirmed cases.
Joe, thank you. NBC News is now reporting 10,000 cases across the U.S. Georgia is among the top 10 states. New York has by far the most cases with more than 4,000. Washington state has more than 1,000 cases but has the most deaths out of any other state with 68. Will Georgia's capacity to test suspected coronavirus patients expand? It is a question we asked the governor to address at the press conference just a moment ago. 11 Live's Doug Richards has more at what's at stake here.
There's plenty of agreement that there isn't enough coronavirus testing capacity in Georgia. The question is what to do about it. Life Hope Labs is a private Sandy Springs facility that does COVID-19 testing.
We're here, we're ready, we have a tremendous capacity.
But Wednesday, the lab only did 80 coronavirus tests. That's less than 1/10 of its capacity. Its founder, Tim Allen, says the state hasn't included that lab as part of its coronavirus fighting capacity, apparently because it's not an approved state contractor. By noon Wednesday, Georgia had conducted 1,508 tests. A day later, the total was 1,831. Of those, a total of 287 confirmed COVID-19, a positive rate of nearly 16% that had risen slightly in the last day. Yet Allen says his lab could easily process 1,700 lab tests in a single day if the state would include Life Hope in its network.
We have followed the protocols by the CDC, and we have the ability to do it. So I don't know if it's for political reasons or other reasons, but we're here and we're ready to go.
Allen says that the tests that his lab has done have been done at cost, and he says they get results within 24 hours.
Doug, thank you. As the number of cases continue to go up, so are unemployment claims. This as Congress rushes to pass a massive stimulus bill, and the first look at some dismal job numbers are now released. NBC's Sarah Dolph has the latest.
On the front lines of the fight against coronavirus, science critical protective gear for medical workers is in dangerously short supply. Running so low, the CDC is advising the use of bandanas when masks aren't available. The Trump administration promising a surge of those masks and ventilators that could be used to protect people and save lives. But the president backing off an earlier promise to invoke a wartime power to draft companies into producing essential equipment, saying it's the job of cities and states to find their own.
The federal government's not supposed to be out there buying vast amounts of items and then shipping. You know, we're not a shipping clerk.
The president briefly raising hopes the government has figured out how to fast track and repurpose drugs to help fight deadly symptoms.
We're going to be able to make that drug available almost immediately.
But moments later, his FDA commissioner suggesting it won't be so quick, and testing still has to take place.
No promises can be made, but one thing that we're doing is really working hard to fast track as much as possible.
Working is what a lot of Americans are worried about, with thousands already out of jobs, and many more concerned they won't have jobs to come back to when the crisis passes. The big three automakers idling production lines for the next 2 weeks. Airlines canceling flights, the stock market losing all the gains it's made in the last 3 years. A day after President Trump signed an initial aid bill to provide some sick leave and free virus testing, legislators racing against the clock to pass a $1 trillion economic stimulus that could help ailing businesses and put checks in Americans' mailboxes in a matter of weeks.
Small business owners all across Georgia struggling to figure out how to stay afloat as they are ordered to close down or demand for business completely dries up. Caitlin Ross talked to an owner today who's trying to survive through the uncertainty of coronavirus.
Charlotte. Courtney Didi is an optimist, but this has hit her hard.
About a week ago, I started crying. I was very emotional when I would run into clients and they're like, how are you? I was holding it back on my own, but as soon as they would ask that question, I would just kind of crumble at their front door.
She's owned Diogi Pet Services and Training for 10 years.
I'm not one to ask for help ever, but reaching out and just being really vulnerable with our client base.
She says her dog walking, daycare, and boarding business evaporated as people stopped traveling and started staying home all day. Now she's trying to figure out how to navigate the complex and changing government assistance programs to keep her business afloat.
I read the whole House bill from beginning to end. It made no sense. There were pieces in there that contradicted each other. So a lot of the time I was like, I'm not really sure how this applies. Does this apply to me? Does it not apply to me?
For the past week, she's been trying to find exactly what's available to help her keep her doors open.
Also following our mayor locally here on Twitter, she's been very helpful in sending out detailed information that makes a lot of sense.
She was on a call with the Federal Small Business Association this morning, learning how to apply for emergency loans that will help cover expenses until her business rebounds. She says all small business owners need to advocate for themselves right now.
Really go to the source of where the information is, and if you don't understand, pick up the phone or send an email. That's really the best way to get the most accurate information.
With a little help, she believes small businesses can survive.
I'm going to be very positive and say we're pushing through.
Still to come, as students move to online learning, parents are being forced to become at-home teachers and shepherds, the best way you can support your child. Coming up next. Chris?
What a day. 80 degrees for a high, plenty of sunshine around, and temperatures really warm with no rain. But let me show you what we've got going on. We're tracking some showers and storms out to the west. Eventually, this system will make it our way. I'll let you know the impacts we'll see from it.
The Speed Feed, sponsored by your North Georgia Honda dealers. It's a Georgia thing.